We heard yesterday from Tony Fauci at a press conference at the NIH that the CDC is close to developing a rapid diagnostic tool kit that could be distributed relatively soon. How helpful would that be?
That's going to be very helpful, and that's one of the keys here. And like Meg was saying, right now, everybody has to send their samples to the CDC, so there's a little bit of a lag and a delay there. And what they're doing is they're looking at getting these tests and farming them out to states and public health agencies around the country. That means it'll be much, much quicker. On top of that, today at their conference, they said they're also working on a serum test. That's a blood test that can look at people and see if they've been infected, even if they aren't showing any symptoms, which they're not quite sure if that's happening or not. But one of the big emphases they had today during the CDC conference earlier was that nobody needs to panic over this right now. There's still no sign at all that there's any kind of community spread in this. And like Meg said, the one human-to-human transmission was very close contact, and they knew that was going to happen. They said they knew that they would have at least one. They're probably going to have a few more, too. They said get ready for them.
Do we know about how the victims of this illness are being treated, particularly over in China, but around the world, and whether antiviral medications are effective or not?
So at this point, there's no antiviral medications that seem to be effective, but they are looking at different ones, especially ones that have treated other viral type infections in the past. And they're seeing if they can help. But as of right now, there's nothing we can do other than what we call supportive care, which basically means bringing them in, putting them in isolation so they don't spread the disease, and making sure that they're taken care of oxygen-wise, nutrition-wise, IV fluid-wise, and then letting them recover themselves. If you've looked at the deaths there, the majority of them have happened in older adults, and that's pretty consistent with these types of viral infections. We knew that, and the CDC is saying, yes, older adults and those with immune system problems are at highest risk, and that's exactly what we're seeing here.
Dr. Torres, I'm sure you're probably hearing it in the kitchens at 30 Rockefeller Center. We're hearing it out here. There's a lot of concern about how worried should I be at this point? I got to ask you, especially when you look at the CDC's flu numbers in the United States, where by January 11th, something like 6,600 people had died. Some 18 million people had gotten the flu this season alone. And we're not closing down cities. We're not closing down airlines. We're not putting up barriers at the border because people might feel sick. So can you put that into perspective?
And what a lot of experts are saying is the biggest epidemic we have right now is the epidemic of panic. A lot of people are getting concerned and overly concerned about this coronavirus. Part of the reason is because it's a new virus. We've never heard of it. It's spreading very, very quickly, as opposed to the flu, where we hear about that year in and year out, and we kind of get immune to that, so to speak. We don't think of it as that bad of a disease, even though it is. And so they're hearing about this new virus. They're overreacting to a certain extent, and that's why the CDC keeps coming back and saying—
Is China overreacting?
China, I don't think, is overreacting on their point, because they're the ones at the epicenter of this, and they're doing what they need to contain it. They're the ones that have the majority of the cases. But what the rest of the world, and the CDC in particular, is saying is, hey, listen, we know it's in China. They're doing a decent job of trying to keep it under control. And they said the main thing you can do today for yourself, for people that are concerned, and for all of us, are the things you do during the flu season. Wash your hands, cover up when you cough and sneeze, and pay attention to the news, pay attention to your public health authorities in case things start changing, because the honesty of it is this is a new virus. We don't know much about it, but we're learning as we go.
Would you travel to China right now?
I would not travel to China right now. I certainly would not travel to Wuhan, China, but I would have no problems traveling to other parts of Asia.